I'm Dr. David Mashhadian, practicing my dream for the past 20 years in the beautiful Rodeo Drive, making people beautiful one at a time. So let's bring it back and give you a little bit of education about breast implant. It's kind of a complex situation. Let's bring it a notch back. So we have a sample here. This is a saline, this is a silicone, and they all have what we call shell. With a saline implant, we have what we call a shell. They all have shells. It is a silicone shell, and the silicone implant also has a shell. It's a silicone shell. They both are silicone. So saline has salt water as the filling material. And what's nice about it is that if it fails, you have the salt water coming out and your body picks it out, and you just basically, your body eliminates it and you pee it out, so to speak. But the disadvantage of the saline is essentially the feel of the implant. They don't feel as natural. They have what we call rippling. And that's what are the drawbacks. Next, we have what we call the gel implant. And now we've gone through multiple generations. We are at the 6th generation silicone implant. So the gel has improved throughout the many years. They do have a silicone shell, and then the material inside is filled with the gel, and then they are sealed in the back. So during the surgery, the surgeon has no option of adding or subtracting to the amount. So let's compare two silicone gel implants exactly the same size by the famous Allergan company. The outside is a shell, silicone, inside is a gel. And what I have here in my hand is a 365 cc. But look at how these are both available in the current market and can be used. But look at how they behave differently. Okay, so the one I'm holding on this side, this is the basic gel. Okay, and this one is the soft touch gummy. There is another one that's a full gummy. What it does is that this is the newer generation material. It's more cohesive. It holds itself together. So less chance of rippling on the side, gives you more upper pull fullness on the top of the breast, and it has much closer consistency to a breast tissue. So this is one of the best implants you could use. One of the main concern is rupture or the leakage. Chances are very low. If you cut this and if it leaks, it just stays where it is. Generally minimal reaction to the body. It can cause some inflammation. You may have to go back and remove it, obviously, and put a fresh one in. Okay, so now let's talk about some of the newest one. Unfortunately, I don't have one here. So let's talk about some of the newer implants, especially Motiva coming into the market. It's also still a silicone shell filled with silicone gel material. It has a micro texturing, which is studied for a short time. There's not a lot of studies behind it. It hasn't been around as long as the smooth gel implant. So I personally don't like to immediately jump on the bandwagon and use the newer products. A few years ago, they did take the textured implants off of the market because of a variety of problems. So I really want to see additional long-term results. And there are many studies. We always have to use critical thinking when we see a new product. It's how many people were enrolled, how the study was performed. It's kind of complicated. I'm not really sure whether there is really an advantage to the newer implant. So for the time being, I'm going to focus on the Allergan. It's the most popular, it's the most versatile product. They have the longest track record. We're gonna wait until using the other product. Let's now focus on a very important question about leakage, okay? And what do you need to know about it and why does it occur? So when you study materials and product, different materials have different kind of modulus of elasticity and fracture points or stress fracture. Stress fracture is like you take a piece of metal, you constantly bend it back and forth, and then after a while it's going to break. So the same thing is going to happen to this plastic. They did lots of studies. This can potentially last through a lifetime. However, as it goes through your body, is constantly moving and bending and twisting and doing a variety of things. There is a chance that it could develop a crease or a failure where things can leak in and out. With the salt water, around 10 to 15 years, the chance of leakage does go high up. Same thing happens to the silicone. However, you don't necessarily have to jump in and do a change on the saline. You can wait perhaps until it leaks, then go change it. I mean, there are different ways of thinking about it. If it leaks and then you try to have it replaced, the capsule can contract and then the surgeon has to make a lot of pocket adjustments. You may be spending a little bit more time in the operating room. It can drive the cost of the surgery higher. So if you want to do it prophylactically, which means you do it preemptively, you go in before you develop a problem, around 10 to 15 years is a good consideration to perhaps get a new one. With the silicone, when it leaks, it's a little bit more challenging to clean up by the surgeon. It can be done. It's not the end of the world, but it can cause some reaction around the skin. It can cause capsular contractures. You may have to do other fancier things. So around 10 to 15 years is a good idea to go in and get perhaps an upgrade. No big deal. Very simple. If it's a simple removal and replacement, it's a very simple surgery, honestly. It really is. And I hope most surgeons don't make a big deal out of it. It's just an incision. You take the implant out, you wash the pocket, you clean it up, and you put in a new implant. You close the incisions. It could be done very rapidly. The recovery is minimal. That would be the best way of doing it. If you wait too long and you do get a leak, it becomes a little bit more complex to replace it and remove it, because cleanup are a little bit more difficult. You may develop capsular contracture, you may develop pain. So always be proactive, take care of your health. Don't wait until you have a problem. When your body is giving you signs that you're having pain, tightness, implants are feeling tight, that means something is going wrong. So stay proactive, get your implants checked, do self-examination, do ultrasound or a mammogram every 3 to 5 years, check the implants, make sure they have no leakage. If you have any question or concern, definitely feel free to reach out to our office. I'll be happy to answer any question or concern.